The surge in COVID cases this summer is again straining Utah's hospitals. The University of Utah Hospital is full as caregivers try to manage the increase in patients. News specialist Jed Bowl spoke with the Chief Medical Operations Officer, who says the return to school over the next few weeks will only make the surge worse.
The Chief Medical Operations Officer for University of Utah Health tells me that this surge is already more difficult to manage than what they faced 6 months ago. The caregivers are worn out, and there are fewer of them.
The hospital is full. We have patients waiting in the emergency room for beds.
Dr. Russell Vinnick says they only have a couple of open ICU beds.
We are barely keeping up, and that's very different from how things were back last December, January, February, where we had enough staff to be able to open up a accessory ICU and be able to really take care of a lot more people.
While hospital counts are lower than at the peak 6 months ago, this surge has been more difficult to manage, he says, because the hospital workforce is stressed and some are leaving.
I do think it makes it harder for people to stay in the workforce and have that sense of commitment when 98% of the patients that they're taking care of are patients who could have prevented this by getting vaccinated. And that's a strain.
Our communities again asking doctors and nurses to battle the virus after they had glimpsed the light at the end of the tunnel.
This has been 18 months now, and we were all happy to be the heroes and put in the extra time, but that's something you can't sustain for a year and a half.
Looking ahead,
most of us who follow this are very convinced we will see a significant rise after school starts.
With kids not wearing masks and vaccination protection limited to those 12 and older.
This will lead to massive outbreaks in schools, schools shutting down, and then their parents, who are our employees, won't be able to come to work.
That's what happened last fall.
So now we are faced with the potential for an even further reduced workforce with more cases. I worry that we're going to be able to care for them.
Urging unvaccinated parents to get their shot now and include their eligible children. For KSL-5 News, I'm Jed Bowl.
Jed, thank you.